Mike for putting today's event on. Thank you, Mike. And allowing me to go on first. That's even better still. And also thank you to all of you for coming today. I'll try not to bore you, but Mike said that the topic for today is action. So I thought, okay, I think the best one is to look about what Diabetes UK and yourself and our group are doing at the moment on taking action about tackling stigma in diabetes. I don't know how many of you know how many people currently in the UK have diabetes, but it is now 5 million. So it is one of the fastest growing and biggest diseases we've got, but people don't talk about it much. And some of the reasons they don't talk about it is because of the stigma attached with it. So firstly, what is it? And it's there, I'm not going to read every line because I know you can all read, so I'm not going to disrespect you there. But you can see there, it's negative attitudes. And it's what people face as a diabetic when they are either in public, with their friends, their family, or even their health professionals. And basically, it's because people don't have an understanding and they don't have the education. So, and it affects everybody who's got diabetes. It doesn't matter what type, it really affects you. So it's an urgent issue, and this is one which Diabetes UK have really taken on board, because 9 out of 10 people who have diabetes experience it. So it's not just the odd 1 or 2, it's most of us, but it's hidden because people won't talk about it. You see it in the media, you see it in health professionals and everything, like I said before. It's also, it's a joke thing. Oh, you've got diabetes. No, I'm not surprised, you're fat. That's a common one. I was at a conference 2 years ago with some colleagues who were in the room, and I went to listen to one of the speakers. There was about 100 of us in the room. He was a health professional. The first thing he said was, how many of you in this room have got diabetes? Nearly everybody put their hands up. And he said, well, you know why you've got it? You're fat. That was his opening comment. To which I stood up and said, how disgusting. Of course, it is not because you're fat. It's a huge number of reasons, and that could possibly be one, but it's not the cause. And another lady stood up, and she must have been about size 8, and she said, do you think I'm fat? And he said, don't be stupid. She said, well, I've had diabetes for 25 years. So he had to give a public apology. But that is what we face. So I just wanted to point that out so you can see, and it has a massive effect on your mental health. To such an extent, you won't talk about anything and you bottle it all up. So the long-term aspects, you can see here, it has serious, it has long-term effects because people think of every excuse possible not to go and see their health professional because of what they might face when they get there. Not, how can I help you? Oh, let me tell you and make you understand what these results mean and how can we work together. You just get, well, if you don't do this, in 5 years' time or 10 years' time, this is going to happen to you. That is not the way to look after people. So it does have a direct impact. It affects Diabetes UK as a charity because of misconceptions. Diabetes UK do not get any funding from the government. They only get money by people giving donations or whatever, although it is the biggest disease. And it costs the NHS over 10% of its total expenditure. And when you consider the complications and everything, it is the highest in terms of heart disease, eye problems, premature death. You mention it, it does, but it seems not to be on the agenda as it should be. But you can see there in 2022, only 2.6% of research funding from the public went into looking into the research of diabetes. 1 in 4 people experience it in the home, at least weekly. You know, now you'd think that your family and everything were the people who'd be supporting you. No. 1 in 5 from healthcare professionals at least a few times a year. And it could be your GP, it could be a hospital appointment, it could be a community nurse, it could be anything. And you can see there that you find people from the Black African, Black Caribbean, South Asian, they have more intense stigma attached to it. And some facts here as well, you know, going through and the experience and everything. So it is huge, but as I said, it's hidden if people won't speak about it. And it's like a lot of things, especially with mental health, people don't want to talk about it. So hopefully today people will open up and we will talk. So it can take many forms, and there's all the examples of the forms it can take. And 8 out of 10 people will experience at least one of these, if not a multitude of them. So, you know, you can see that you wouldn't think about judgmental looks. For instance, you might be taking insulin. Say you go out for a restaurant with your friends and that, and you think, oh God, I've got to take insulin. So 9 times out of 10 people stand up, off they go to the toilet. Why? Why can't you take your insulin while you're sitting at the table? They do it in a discreet manner. Why should you have to leave the environment you're in to go into the toilet? 9 times out of 10, if you're seen going into the toilet and you take an insulin pen out, what happens? Oh God, they're on drugs. You can see the misconceptions people get. The same at the table. I know people who have gone for a restaurant, took the pen out, they've been escorted out. That's not right. They're human beings. They've got to have this insulin, in some cases, to live, if you're type 1. So, we've got to change it. And it's only by education of people, and people with diabetes standing up for themselves and saying, look, this is because of where I get that change. So, and we've got to change it with the media and everything. We've got to continually tackle people who treat us wrongly. Examples, obviously, there what families say. You can see there a woman with 30 years. Diabetes UK's website, I've got loads of this. We had a conference last year, which the Mayor very kindly attended, thank you, which we put on as our diabetes patient group. And we had young leaders, type 1 young leaders from Diabetes UK. Even I was in tears at their stories, the way they were treated. But it's fact. Treated when they're in school. You know, like, first type 1 diabetic in the school that the nursery team had ever seen. No training, so they didn't know how to cope. So felt uncomfortable doing things in class, felt uncomfortable testing or eating something different to everybody else. Trying to explain to my friends why I had to take a pen and insulin. People who you think were your friends, and sometimes you find out they're not really your friends. No allocated safe space to do these things. We need to change. Everything needs to change. And the trouble is, change takes such a long time, but we have to do it. I don't go to appointments. I know I'm stupid, but I make up excuses because you know what you're going to face. That should never be the case. You should be able to speak openly to your health professional and say, I want help. Please explain to me. Now, 9 times out of 10, most of them most probably don't know as much as what you do. So it's entirely up to them to listen to you as well. A couple more. I don't tell people I've got it because I feel ashamed. Why should you feel ashamed? You know, It's like any condition. Why should you be ashamed of telling people what you've got? And if your friends and that really have a go at you, are they really your friends? Yeah? You have to start to question things. Stop crying, you're only doing it to get attention. Yeah, it's not right. It's just not right. But if we don't tell you publicly these things go on, how do you know they go on? People look down at me, they think you're not capable. You start to question yourself. You think, it's all my fault. You know, there's all sorts of things happen. The impact. Poor mental health. You blame yourself. You direct the blame at others with diabetes. If it's one where it's in the family and then you get it, you blame the family. It's your fault. Your fault I've got it. No, it's because of the family traits and your genes and everything. You're at a higher risk. It's very difficult. You miss appointments. You get more serious outcomes because you've missed those appointments. Discrimination in the workplace. It happens all the time. And of course, there's no investment. So, what do we do about it? Well, Diabetes UK did a big thing with World Diabetes Day last year. They are carrying it on into this year. There's many ways that it can be done. This is the sort of thing they're doing. They're raising awareness. There's a lot of research going on with universities in London. They're funding new research and they started the discussion. And this today, I welcome the opportunity to be part of that discussion. Empower you to share your stories. They have a volunteer stigma panel. Engage with existing audiences today. And long term, we need to change the public's knowledge, attitudes and behaviour. It won't happen overnight, but the more we do it, the more people will understand and the more people accept it, and hopefully people then will go to their appointments. So what's the tips? We have to listen, we ask questions, we don't make assumptions. If you're not sure about any aspects, always ask. Diabetes UK have got a wealth of knowledge on their website. All this and loads more in stigma is on their website. If you get something wrong, don't feel you've got to apologise or worry about it. Just be open and honest. But nobody should be stigmatised for any health condition, not just diabetes, any health condition. And my job, spread the word. Because the more we spread the word, the more people understand it. And hopefully will accept it and help. There's all the three things you can do here. You can join diabetes communities, you can tell us what you need, and you can sign a pledge. And all you've got to do is go to any of those diabetes websites to do any of that. I hope some of you will, because the more we can do it, the better. I've only got one slide left, but before we go to it, there's another thing I do want to take the opportunity. I've got 3 minutes, that's all right. And that is, and this is about action as well. I'm going to put this in front of here, and it's also on our table. The last few months we've been working with MPFT, I'm pleased to say. It came up from our conference last year. This is one of the actions, was about foot care. Our area, when I say our area, I mean Staffordshire and Stoke-on-Trent, have got some of the worst amputation rates in the country. So what do we do about it? Just accept it, or do we act? So we're acting. And we've started as our group, this is our local group, we put together a questionnaire which has gone out to the whole of Staffordshire and Stoke-on-Trent on what sort of foot care are you getting at the moment? You know, be honest and tell us. Not so we can pinpoint and blame people or say that surgery is crap compared to that one. I don't want to know all that. I want to know where the shortfalls are So if we start to put things in to make it right, it's been quite a struggle to get this questionnaire out. Although I'm very pleased to say we've now got 218 responses. We're working with MPFT Podiatry Services, because not many people know about podiatry, because you have to go through your GP. But they're changing. They want to work with us, our group, to change it that by the end of the year, beginning of next year, it's going to be a self-referral process. But they want patient involvement in co-producing the new pathway, the communication, everything. So we've got a very busy time coming up for the next 6 months, but we will get there. So if anybody wants to know more, just go on the QR code. The survey will be open as long as I decide to keep it open. We're starting to pull all the results together so far. It won't be surprising to note that the results we've had so far, 1/3 of people get no foot care test at all in their annual review. And we have the highest amputation rates. I wonder why. So we need change, so there's action. So finally, diabetes is not our fault if we've got it. It's nobody's fault. We just have to make people aware and treat us like anybody else. So, on time for once for me. Thank you so much for listening, and I appreciate coming on first. Thank you, Mark. Thank you. Thank you, John.